good health and well-being. Overview. Ensure healthy lives and promote well-being for all.
Since the creation of the Millennium Development Goals, there have been historic achievements in reducing child mortality. Child mortality refers to the death of children under the age of 5, improving maternal health, and tackling HIV and AIDS, tuberculosis, malaria, and other diseases.
In 15 years,
the number of people newly infected by HIV each year has dropped from 3.1 million to 2 million, and over 6.2 million lives were saved from malaria. Since 1990, maternal mortality fell by 45%, and worldwide there has been an over 50% decline in preventable child deaths globally. Despite this incredible progress, AIDS is the leading cause of death among adolescents in sub-Saharan Africa, and 22 million people living with HIV are not accessing life-saving antiretroviral therapy. New HIV infections continue to rise in some locations and in populations that are typically excluded or marginalized. Chronic and catastrophic disease remains one of the main factors that push households from poverty into deprivation. Non-communicable diseases impose a large burden on human health worldwide. Currently, 63% of all deaths worldwide stem from non-communicable diseases, chiefly cardiovascular disease, cancer, chronic respiratory diseases, and diabetes. The cumulative economic losses to low- and middle-income countries from the 4 diseases are estimated to surpass $7 trillion by 2025. Additionally, there continues to be underinvestment in the social circumstances and environmental factors affecting health. The job on HIV and health is far from done. Recognizing the interdependence of health and development, the Sustainable Development Goals provide an ambitious, comprehensive plan of action for people, planet, and prosperity, and for ending the injustices that underpin poor health and development outcomes. Sustainable Development Goals 3 aspires to ensure health and well-being for all, including a bold commitment to end the epidemics of AIDS, tuberculosis, malaria, and other communicable disease by 2030. It also aims to achieve universal health coverage and provide access to safe and effective medicines and vaccines for all. Supporting research and development for vaccines is an essential part of this process, as well as expanding access to affordable medicines. The goals of 3 targets are: by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Next, by 2030, end preventable death of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births. Next, end the epidemics of AIDS, tuberculosis, malaria, neglected tropical diseases, combat hepatitis, waterborne diseases, and other communicable diseases. Next, by 2030, reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment, and promote mental health and well-being. Next, strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. So that's all. Thank you.